Hey wellness friends, today I am here with Dr. Mike Pugh, and Dr. Pugh is a chiropractor and he's also the owner of Tate's Creek Chiropractic and the Cryo House. And the Cryo House is why we are here today, because this is something that maybe some of you have never seen before, but this is a cold therapy type of treatment, correct? Can you tell me what is the cryotherapy and kind of how you got interested?
Oh, absolutely. So, originally that business was a couple doors down from us, and they were doing great. The family that owned it moved away, and it was an opportunity for us because it's a fantastic adjunct to what we were already doing with our clinic. I always believed in the use of ice to mitigate the symptoms that we saw with a lot of our patients. And so putting the Cryo House and their products in here was just a natural thing for us. Yeah.
I come from a therapy background, and we've always used therapy with our patients, but we use typical ice packs or the packs you put in the freezer to put them on ankles and knees, etc. So this is not that.
It is not that. It's a little colder. And so we use liquid nitrogen. It vaporizes as it's distributed. The tank can go as low as about 160 degrees below zero for short bursts of time. So a treatment time is only about 3 minutes. And as I joke with our patients a lot, like, we're going to put you in there 3 minutes or until you say uncle, whichever comes first. And so it's cold, but it's way more tolerable than, say, an ice bath or a cold shower because of the absence of the dampness of it. So it's a dry cold.
I'm a believer in cold therapy. I'm also a believer in heat therapy too, just the kind of the stressing the body theory.
Absolutely.
I hate ice packs. I hate getting in ice baths. I was leery about this because I hate the thought of the cold. But you say this is not
way more tolerable than being in an ice bath. I would never do that in a million years. This is not an issue. The first time I got in it, I made my staff videotape me while we were doing it so that everybody would say, "Hey, did you stay the whole time, Doc?" "Yes, I absolutely did, and I have it on video." My goal was 3 minutes, as stoic as possible. Turns out I wasn't all that stoic. But it's cold.
Well, so people that get in there, what are we trying to achieve?
So really, it's great for managing pain and it's great for recovery. And so, originally this was a CrossFitter athlete sort of thing. And we see a ton of athletes for it, but then we see a ton of folks who work in factories or they work in healthcare or they work in restaurants, and they just find that they feel a whole lot better and their body processes their inflammation way better when they've been in the machine.
When you do anything, you have to have people sign kind of a patient waiver. Absolutely. And all that. Are there anything that we need to worry about before somebody would get in here?
So we're super careful with that. There are not a ton of contraindications. Folks with a history of bad heart problems, folks with a history of really bad high blood pressure are the first folks that we kind of go, hey, you know what, this might not be the best thing. But we have other options, like our local cryotherapy unit, where we can pinpoint a specific area. So we have things that folks who have heart problems or folks who have high blood pressure or other contraindications, we have other things that we can do with those folks, just not in the tank.
Is there a number of sessions that really help people? Do you get a benefit from one session, or do you need to be here?
Everybody comes out of it knowing that they've been cold and they feel better, they feel refreshed, they feel invigorated when they get out, and I love that. We have folks that are doing a couple treatments a week. We have folks that are doing a couple treatments a month, and everybody gets a benefit from it. And it's kind of get in where you fit in sort of thing as it relates to using the tank.
Do people get more used to it? Like they say, oh, the first few sessions were kind of hard, but now it's a little bit easier.
Absolutely, and we actually have 3 different settings, 3 levels for folks, and when everybody starts off with level 1, and when they're ready to move to level 2, they move to level 2. When they're ready to move to level 3, which is, it's colder, they move to level 3.
I have a problem with sinusitis, and they trigger migraines from sometimes. Whenever I put something really cold on the back of my neck, it tends to help with my migraine. Would this be a possibility for people who have headaches or migraines to help?
Absolutely. And then in addition to what we do with the local cryo, working on shoulders and elbows and folks who have contraindications to the tank, we do facials. And our patients who have headaches love those cryofacials. It makes them feel so much better. So we spend some time targeting various places on the face, but also on the back of the neck, as it associates with their headaches.
So you've got a local unit, and you're going to show us that.
Absolutely.
And then you're going to make me get in this? Is that what
I'm going to let you get in it.
Okay.
3 minutes or until you say uncle.
Okay, well, let's take a look at the local unit first, and then we'll see how I tolerate this.
That sounds great.
Okay, Dr. Mike, so now we're here for the local cryo treatment.
Absolutely.
I have a torn quadriceps tendon, and when I first got this, I was sent home with something called a Game Ready, which is a local ice pack, basically. It circulates cold water around your knee and gives you a little bit of compression. So I've been treating my knee with ice, so this is a cryo treatment. Can you tell me a little bit about what this unit is?
So we're using nitrogen vapor again here. It's going to be cold, but it's going to be dry, so it's going to be more tolerable. You'll see that we use laser lights to pinpoint, right? We'll watch those as they converge, and when they do that, we'll know we're at the appropriate distance. We're going to measure the temperature of your skin in an effort to get it down to about 55 degrees.
When you're using this unit, is there any, do you prep the knee with anything? Like when I do ultrasound, you got to prep the knee, you got to put the gel on.
Straight.
Well, this is
We
pretty-
just
this
walk
is
right
pretty
in,
nice
right?
then.
Been treating a lot of young athletes with this
Right.
for athletic injuries, but then older folks who have some like chronic joint-related degenerative changes and things like that get a lot of benefit from it too.
All right, well, let's give this a go and see how we do. Okay, now I do feel the cold. As the closer he gets, the colder.
Okay, so we've got your skin at about 75 degrees now. We're going to lower it to about 55.
Okay, is that your stake monitor there?
That too. It says you are medium well.
Now, when I played baseball, and if you had a player that gets hit with a pitch, or the pitcher maybe is starting to get a sore arm, they would have this can of spray that they would spray on. Is that sort of what we're doing here?
A lot.
Is it?
Yeah, a lot, but more sustained.
Okay.
Right? I guess a little less of an emergency and more of a therapeutic application for it.
Cold has been in sports forever.
Absolutely.
When I was a young player and you would hurt your ankle, they would just immediately put your ankle in a bucket of water with ice. A treatment that's been around probably as long as human beings have been around. We realize that cold is therapeutic and helps with swelling and pain. When my quadriceps tendon, after the surgery, the medication that I was taking was only really helping take the edge off the pain. But when I would put my leg in that wrap that would put the cold around it, now that was really how I got pain relief. The cold is not only good for the swelling, but man, was it good for the pain relief.
Yeah, I mean, we talk about the metabolic changes that happen in there with the application of the cold, how it shrinks the blood vessels, which pushes all the swelling and inflammation out of those injured areas. And then when the cold is over, those open back up and the nutrients can get into the deep down injured structures.
Right. So I assume you're using the monitor there, the laser monitor, to make sure the skin doesn't get too cold?
Make sure we don't get too cold, because we want to make things better.
You get an immediate sensation of almost numbness. So the cold, you're not feeling the cold. You're really just feeling kind of numbness on the knee. Not so much like you're not feeling like you're putting a cold pack on the knee. This feels actually this feels a little more tolerable.
Yeah.
To me. Now, some people put cold packs on their neck or up around their head. Could you use this on any place?
Absolutely, and a lot of our patients with headaches love to come in and get the cryofacials done. Okay. It really helps them kind of ease them through the symptoms that they have and stuff.
Okay, so a cryofacial is not a cosmetic procedure, it's for pain relief? Is that what we're doing?
So a little bit of both, right? So we do get a lot of closing of the pores and tightening of the skin in the face from that as a byproduct. So people do it for a facial also, but we've just found that it works really great for our headache clients.
Okay, what about puffy eyes? They say that if you put a cold compress on your eyes, it helps with diminishing. And I have puffy eyes. Is this something?
It certainly can, but we're super careful about getting it close to your eyes because we just don't want to.
Do they wear like a goggle or something like that?
Yeah, but we just try to stay away from that area.
Okay, well, I got to tell you, that treatment was very interesting. Again, my preconception was that this would be too cold for me to tolerate. And the first few seconds, you do feel the cold, but after that, it kind of numbs up, and then you don't really feel much. Okay, tell me about some other aspects of this. So we know we can do the joints. We know that the facials. Is there anything else you do with this machine?
Shoulders, knees, elbows, ankles.
How about bottoms of feet?
Absolutely. Okay, so thank
Plantar
you.
fasciitis.
Plantar fasciitis. You know, one of the things that we see in here so much is plantar fasciitis, and I think I was okay with managing it before, but about 10 years ago, I tore my plantar fascia swinging a softball bat really hard. And so was able to rehab that without surgery.
Oh, really?
Through the use of cryotherapy, but before we had this, through the use of cold and through the use of kinesio tape. And so we love using kinesio tape with our plantar fasciitis patients here, but this stuff it's a natural adjunct in so many ways to the stuff we were already doing here.
So you are a chiropractor, and your main practice is chiropractic. We're talking about the Cryo House today, which is located within your facility, but you're a full-service chiropractor.
Full service, and you know, other folks that are patients of other chiropractors, they come here, they get cryotherapy. You don't have to be my patient to be a cryotherapy patient. They're separate businesses, they're separate entities, and so you know, you don't have to be our patient to take advantage of that stuff either.
Okay, so somebody like myself who is just coming in off the street and I've got a knee that needs some therapy, I can actually come in here and just get the therapy.
Yeah, absolutely. Okay. Yeah, no requirements.
Well, as you can see, I'm officially a Cryo House supporter now, and we're going to go try and get in the machine and see how long I can stay in there. I'm putting the over-under at 2 minutes. All right, everybody, I am ready to go into the cryo machine, but now Cassie's here with us, and she's going to explain to me what we're going to do before I actually get into the machine, correct?
Correct. So you're already changed. We just make sure that you don't have any metal on.
Okay.
Anything metal on the outside of your body. Inside is fine. You will keep on undergarments. We'll give you socks and slippers and a robe.
Okay.
I'm going to open this door, and once you get in and you're all closed up, you're going to hand me the robe.
Okay.
And I will hand you a pair of mittens. We just need to make sure all your extremities are covered.
Okay.
And then we start a 3-minute session.
Okay. So I want to get in there, guys, and I'll try to talk to you as I'm in there. If my teeth are chattering, I may not say much, but are we ready to try it?
We're ready.
Okay, here we go.
I'm going to get it pre-cooled for you.
Okay.
Just a moment.
Just a second. Step up with this bad leg. Okay.
Okay, and I will take your robe.
Tear it off.
Okay.
Thank you.
You're welcome. There's your mittens. And if you duck down just a little bit, I'll put this over your head.
All right, duck down.
Yes. Lean back just a little bit. This will just make sure the nitrogen doesn't get in your face.
Ah.
All right. I'm going to set the level. And you just tell me when your mittens are on.
I have on mittens.
All right, and you're off.
Okay.
And you can move around while you're in there.
Okay.
You can turn around, you can bounce up and down, anything to keep your body warm.
Okay.
Okay?
What we've seen over time is that everybody wants to know how much time they have left, but nobody wants to know how cold it actually is.
Yes. Yeah. No one asks that.
Okay, so Dr. Mike,
Yes.
now how cold does this typically get?
On level 1, we're going to be in the 120 below range. Level 2, it'll go up 140, 150. Cassie, correct me if I'm mistaken.
Up to 160.
Okay, up to 160, and that's level 2 or 3?
2.
Okay, level 3, what do you think?
Up to 180.
Up to 180 below.
Okay.
But it's a dry cold.
Right.
It's like they say in Phoenix, it's a dry heat.
Exactly.
Yes, you can still cook an egg. but
Yes, so is an oven. Yeah. You doing okay?
Okay. So what I can feel is you definitely feel the coldness on your skin.
Yes.
But it is nothing like jumping into a ice bath.
Correct.
When you jump into an ice bath, that it takes your breath away.
Yes.
The shock of the ice bath. This is more of a gradual feeling, I guess.
Yeah. Yeah. It's more tolerable.
It is more tolerable. Yeah. Absolutely. Absolutely.
I say that a lot, but until you're in there, you don't really understand. When I say it's more tolerable, I mean it really is.
We talked a little bit about Wim Hof, the Iceman, how he's kind of the forerunner of ice therapy. Now, he talks about breathing.
Yes.
Do you talk to your patients or clients about breathing while they're in here? Because I'm going to try a little bit of that.
We just try slow and under control, but not a lot of those. Like I'm not in here that much when patients are in it. One of my staff members typically is, so I don't really have that conversation with folks a lot. But you tell us what you know about that.
One of the things that he talks about is being able to get into a state of embracing the cold instead of trying to fight the cold. But to do that, he talks about his breathing, and it's almost like hyperventilating. You're in as big as you can get it, and then out immediately. So there's no rest in between. So I'm going to do just maybe 30 seconds of the breathing, just so that you can see how that works, and I can tell you how it feels as I'm doing it. So we're going to go. So a little bit of hyperventilating.
Right.
Definitely feeling more comfortable.
Good.
You are done.
No way.
Yes.
Yeah. I can't believe this. Ladies and gentlemen, that was relatively easy. And I'm, as my staff will tell you, I'm a bit of a weenie. So that was
You did great.
That was no problem at all.
Awesome.
Okay, so definitely recommend, if you're worried about this, if you're worried about it being too cold, if you're worried about, I can't take this. No. Way easier than an ice bath. Way easier than a cold shower, which is part of the Wim Hof program. If you can't have an ice bath, they say you can always take a cold shower. I hate that.
Yeah.
This is much
way
easier.
more tolerable.
Yeah.
Way more tolerable.
I could have easily stayed in here another 2 or 3 minutes.
Awesome.
Yeah. So
Awesome.
no problem with that. Okay. All right. Nothing's breaking. That's good. That's a good sign. Nothing's snapping off. I managed to do the full 3 minutes, so the over-under at 2. If you went under, you lost.
That's right.
I probably lost because I would have thought that 2 minutes would have been pretty good for me. But the reality is this was a pleasant experience. You do feel cold, but the longer you're in there, the more it mitigates. And by the end there, really and truly, it was basically, I probably could have gone outside and it would have felt similar to me. So not a bad experience at all. Dr. Mike, thank you so much for your time.
Thank you so much.
We appreciate
you
you having us
very
in
much.
today.
Yes, sir.
So we'll put everything in the description for Dr. Mike, your chiropractic practice, and also the stuff that you have on the local unit and the big unit for the cryotherapy.
Fantastic.
Okay. Thank you very much.
Thank you very much.